All right, guys, so what we're doing right here, it's doing our demarcation or chiseling of the lower back, paraspinal muscles, as I was telling you guys about. Then the definition as the sacrum goes into the insertion of the glute muscles. We're gonna take care of the love handles. We use a curved cannula that allows me to go in on the curvature of the gluteus muscles. Then in men, we try to make a little more brisk of a transition between the gluteus muscle and the lower back. The reason why is because it looks very athletic, very sexy when a man has a very muscular butt, muscular and round, and that's the definition that is provided by the muscle itself with a little bit of fat as it goes into the back, creating more of a shelf effect. In women, that is not so attractive, and why? Because it looks a little fake. What we do in women is we try to make the transition more smooth between the back and as the gluteus muscles start. Now, again, we're creating the definition right here. It's pretty much already done. Now I'm just gonna work on defining the paraspinal muscles on the sides. For that I do deep liposuction, but I guide with my thumb where my cannula is going at all times to make sure that I always know exactly what I'm going to be doing. This is where the rib cage starts, paraspinal muscles. That's usually a depression that looks very sexy on guys in the mid back. So that's what I'm trying to create here. All right, guys, we're doing the arm. For the arm, the important things to have into consideration is where the muscles are located, where there's supposed to be no fat, and where there is a little bit of fat that should be on top of the muscle to make it look even, pop even better. So in the lower portion of the arm, there's supposed to be just a tendon that goes down into the elbow, okay? And then what we do here is we basically try to empty it out as much as possible to give them a little more of an illusion of a bigger triceps, okay? Then we're gonna go around the triceps. So I go usually from below, underneath, and then we chiseled the part that I call the Nike sign. I got that from one of my mentors, Dr. Alfredo Hoyos, that he does the chiseling, which is the lower portion of the triceps muscle, and it gives the arm a very well-defined shape. It looks fantastic. So as you know, now here's a lot thinner, here's a little bulkier. Now I thin this area prior to this, which is the upper insertion of the triceps muscle. So the triceps looks bulky. It goes into a depression right here in the axilla, and it goes into another marking right here in the lower portion of the deltoid and upper portion of the triceps. The next thing I'm going to do is I'm going to create a line that differentiates the triceps muscle from the biceps. For that, I go with my cannula along that edge between the two muscles. Gentle, because I want to create the separation between the muscles, but not create a group that is too deep that makes it look unnatural. And it goes all the way to the lower portion of the arms. As you see, beautiful fat is coming out of there. It looks nice and pink. There's no a brisk or a obvious amount of bleeding. If you guys see, there is a depression right now that looks very nice between the triceps muscle, the biceps, right where the deltoid is inserted into the humerus. Okay, at this point, Ricardo, my colleague right here, has already done some of the deep liposuction in this area in front of the dorsalis to make sure that the muscles are chiseled and well framed. Look, guys, see how beautifully defined the buttocks looks? Very nice, very chiseled. You can see the insertion of the glute medius, glute maximus, and a little bit of fat on top that actually accentuates that shape. See how the paraspinal muscles go down, insert into the sacrum. They give the middle line, and how the insertion actually creates that beautiful shape of that butt. That looks very masculine. Okay, now the other part, which Ricardo and I will do, is to try to reduce a little bit of the petrochanteric fossa, creating more like what Ricardo was mentioning earlier, because he was showing me a picture of a very muscular guy where we can actually see a little depression right there. I'm going to try to do that in a minute. As you guys know, I always work with a team, because if I do this procedure myself, the entire thing is going to take me somewhere between 8 to 10 hours. So I work with a team of certified physicians that actually do this with me. But I do all the final chiseling and design of everybody, as everybody is completely different. And look how it expands. I inject. Perfect, 150. So see the shape of the posterior, middle, and anterior. Anterior, we're gonna apply some more. Now I'm gonna go into the triceps. Start superficially, then I'll look for the belly of the muscle. Pierce it. And inject into the body itself. 50 cc's. External, and I'm gonna inject.
That's what gives the shape,
medium,
right?
the shape, exactly. See? Or injects. See the shape? You see how it grows? All right. See the shape of the dorsalis lateralis. So that is really the wings that give a guy the triangular shape. All right, guys, the laws of claroscuro. We use shapes. We use lights in order to not recreate, but to actually accentuate the shapes. So we see the clear, nice, lighted areas where the muscles are, the gluteal muscles, paraspinal muscles, the lateralis, traps, shoulders, triceps, and we see the darker areas where crevices are, right on the spine, on the sides, where the love handles used to be, that they should not be there anymore, and also between every insertion of every muscle. It looks extremely athletic, it looks really good. We're going to flip him and finish the front part. See you soon.